everything that I anticipated in what she looked like when I left the hospital last night. So I can't imagine your shock and your grief and your everything that you must be feeling, and I'm so sorry. I just, my heart breaks for you, and I'm so sorry.
Thank you, Dr. Eriksson. I think that you are on the right track, but I don't believe that your orders were followed, and I need to ask you some very important questions. The sildenafil that you prescribed for her, who was responsible for administering that, and when?
So the ICU nurses were responsible for giving that to her, and basically it was right after we spoke. It was
okay. Okay, then I'm really, really upset, Dr. Eriksson. They did not give her this medication until 8 o'clock at night. And I went in at 7:45 and she was breathing terribly. And I said, what is going on here? She's breathing worse than when I left. And who is attending to her? And what are her respirations? And why hasn't she been given the medication? And they said that you told them not to give it until 8 o'clock.
Oh, yeah, no, it was probably that situation is unfortunate that the protocol for administration of medications on an every 8-hour basis that's where the confusion lied. Unfortunately, is that the 8 p.m. mark. But no, my orders were given as soon as we got off the phone. So.
And now Princess is dead because they didn't. And she's a very small dog, Dr. Eriksson, and I believe that she was neglected. When I went in there, they weren't even aware of her breathing. No one was paying any attention to her. Everything was about this dog that was on a ventilator. Well, I understand that, but my dog is a patient there too, and I'm not upset with you because I think you did everything right and you were on the right track. I think she did have some pneumonia. I saw the infiltrates. My vet's going to look that over. But I am extremely upset that the medication they just didn't care about my dog. Dr. Davidson wrote her off almost from the minute he examined her. And he came in and told me that she was deteriorating and I needed to make a decision as to whether to intubate her and give the medication more of a chance to take effect or whether to let her go, which would be reasonable. She's an 8-year-old dog who was perfectly healthy yesterday. It is not reasonable to let her go. I don't know where he got his training or where he's coming from, but I really think that is just, a disgrace. And I also see here that you said corticosteroids. They never gave her any of those either.
Yeah, we wanted to, so typically what I'll do is give the antibiotics a chance to work and then give the steroids. Reason being is that if you give steroids right away, what our concern is that any infection that might be there would kind of take off like wildfire. The reason being is that steroids without the antibiotic in that situation suppress the immune system. And so that was I was like, okay, we're going to definitely do antibiotics. And then if she's not getting any better, when we talked about that 48-hour to 72-hour window.
I see.
Take another x-ray. At that point in time, if it didn't look like she was clearing up or if she, was
yes.
making abnormal lung sounds, to go ahead and do that. But
well, everything you said made perfect sense. And who is responsible for supervising those nurses to make sure that they are doing what they're supposed to be doing? Because my dog was not given that medication for 3 hours and she died.
Supervisor of the nurses.
And who would that be?
Sure. Yeah, so it was either it's either Dr. Davidson himself or it's Janine, who is the overnight supervisor for the nurses. So that's typically the person who's in charge of the ICU.
Well, Dr. Davidson was, I believe, this is gross negligence. My dog was a service animal, psychiatric service animal. She also worked in TV and television, and besides being a pet that I love more than anything else in the world, she was a very valuable dog. And he wrote her off from the minute she came in there. And I need explanations from him. He's supposed to be calling me back too, but there is no explanation. You told them to give it right away. They didn't. He didn't supervise them. And so the ball wasn't dropped just in one place. He was busy because these respirators, according to the website, are a special interest of his. And he didn't want to be distracted from that, and he neglected my dog. And when he walked by me when I was on the phone at the bottom of the stairs, and the other vet had said, "Oh, he told you she went into cardiac arrest twice. He just told you that in your meeting with him." I said, "Oh, no, he didn't." I said, "We talked about whether to intubate her to let the medication work if she declined, or whether to let her go." And he said nothing about that she was in respiratory arrest. And then when he passed me on his way home on the stairs, I was on the phone, and he didn't say a word to me about her being in a respiratory arrest. He was just interested in getting home. He did not care about my dog and what was going on.
I'm so sorry.
Yeah.
I'm so sorry. I mean, unfortunately, I don't have anything other than that to say, and that I'm...
Well, that's not, I know it's not your fault, and so it's hard for you to speak for him, and I appreciate that you have told me what you've told me, but I am really, not going to be able to let this go. This is a perfectly healthy dog that had a lot of functions in my life, and his whole attitude from the beginning was that he really, didn't want to pay too much attention to her. And
knowing him, I think, like, so your experience with him, there's nothing, like, I can't, obviously, like, that's how the perception and what it is. I can tell you from knowing him personally that's not, but I know that his general demeanor is more one of, I guess, more of an introvert, and so...
Yeah, but introvert is different than someone walking right by you on their way home and not telling you that your dog is in arrest. You know why? Because he didn't want to be bothered dealing with it. And so he lied to the other vet and said, "Oh, I told her, we just talked about it, that her dog was..." Because that vet was very insistent that he had told me that. And I said, "No, he did not." I said, "I'm not lying. He did not tell me that." And the breeder was on the phone with me, and we did not discuss that. So why he would say that to her is just so that she would have to handle it, because he wanted to go home. I mean, this is unconscionable. I really, guess I shouldn't say any more to you about it because it wasn't your fault. But I do have a question. I have a question. I looked up his license, and it shows that he got his license in 2016. Has he only been practicing there for a year?
Oh, that's the New Jersey license. No, he's been in the Manhattan office. So he's had a New York license for over 10 years. No, he's a very, very accomplished criticalist. So, yeah.
Well, he's negligent. He was grossly negligent with my dog, and I'm very, very upset about this. But I'm not going to keep going on and on about it with you because it wasn't your fault, and I'm just so upset because when I hung up with you, I was very encouraged, and I knew that she'd had a bath, and I thought she got some water in her lungs, and I kept telling him that. Why wasn't a thoracentesis done if she did have some fluid in there?
Oh, no, that would have killed her. Yeah, no.
Why is that?
That would have... Oh, because it was in her lung tissue that she had the problem. Thoracentesis is when you have fluid in your pleural space, and so that's a different type of mechanism of fluid accumulation. And she did not have any in her pleural space. I would have seen that on my ultrasound in addition to seeing that on the X-ray. So if we would have poked her in the lung, it would have been bad.
Okay, so the infiltrates...
That would have been a painful death. Like, that would have been awful. So.
Yeah. What do you think the infiltrates were from?
broke up there.
Yeah, the infiltrates, what were they, do you know?
We don't, because unfortunately, like we talked about yesterday, we would have had to, like I said, it's like even just because of what I just said too, like taking a biopsy of your lung, you're not going to do that. That's something that you do, like, you know,
Okay.
you're just not going to do that because that's like a cutting open and taking a piece of the lung.
Right.
The other is that you anesthetize them and do a scope. Unfortunately, when I talk to, you know, the internist who does scopes, they're like, anytime an animal's in respiratory distress, we don't do scopes then because we can make them worse. And so what we typically would do is like get them stable to the point, you know, where they're basically well controlled, and then we do a scope to try to figure out what that underlying infiltrate is. So is that infiltrate anything from infection, inflammation, acute lung injury, and then neoplasia is always unfortunately on the list because even, you know, as we know in kids and in puppies, we can have cancer even at a young age. So that's always, you know, the kind of the serial kind of differential diagnoses that we kind of go through. We say, okay, it makes sense that this would be inflammatory infectious, just given her acute onset, and then trying to figure out what the underlying, you know, what caused it, whether she aspirated or something like that. So,
well,
unfortunately,
do you think it was from water from the bath?
It's so difficult to know. You know, like could that, like, unfortunately, yeah, I have to say